Stop everything you're doing right now because what I'm about to share with you is the information that most doctors will never bring up during a routine appointment. There are seniors living well into their 80s and 90s who have virtually no history of cancer. And when researchers started looking closely at what these people had in common, the findings were shocking. Not because of what they were doing, but because of what they were doing that conventional wisdom had always told them was wrong. I spent over 2 decades working in integrative oncology and preventive medicine. And today I want to talk directly to you, the person watching this right now. How old are you? Drop your age in the comments below. I read every single one. And your answer is going to help me understand who's watching, so I can keep making content that truly matters to you. Now, before we go any further, if you are not yet subscribed to this channel, please hit that subscribe button right now. We release new research-backed health content every single week, and the information we cover could genuinely extend your life and protect the people you love. Hit subscribe and then let's get into this. Here's what grabbed my attention years ago. A landmark study published out of Harvard's Chan School of Public Health tracked over 120,000 adults for more than 2 decades and found that certain lifestyle behaviors, many of them counterintuitive, were associated with up to a 61% reduction in overall cancer risk. 61%, that number stopped me cold. And number 2 on our list today is the one that surprised even me as a physician. So make sure you stay with me all the way through. Before we dive in, I want to ask you something personal. Have you or someone you love ever been told that your family history means cancer is just likely in your future? Or maybe you've been doing everything right, eating well, exercising, and you still feel like something is missing? Tell me in the comments. I genuinely read every message that comes through, and your story might help someone else feel less alone. We're counting down from 7 to 1, ranked from the least known to the most powerfully protective. Let's begin. Number 7, and this one surprises almost everyone, is strategic, deliberate sunlight exposure. Now, before you panic, let me explain exactly what I mean. The medical community has spent decades warning us away from the sun entirely. And while excessive exposure absolutely increases certain skin cancer risks, a growing body of research reveals something most patients are never told. Controlled timed sun exposure dramatically reduces the risk of at least 12 different internal cancers, including colon, breast, and prostate cancer. A study from the University of California, San Diego, found that individuals with the highest vitamin D levels, which the body produces when sunlight hits the skin, had a 67% lower risk of internal cancer compared to those who were deficient. After the age of 70, your skin's ability to synthesize vitamin D drops by nearly 75% compared to when you were in your 20s. Your body becomes far less efficient. This means older adults need strategic sun exposure, even more, not less. The sweet spot is 10 to 20 minutes of direct midday sunlight on your forearms and legs without sunscreen between the hours of 10 in the morning and 2 in the afternoon. Always protect your face and never burn. Pair this habit with magnesium-rich foods like pumpkin seeds or dark leafy greens. Magnesium activates vitamin D in the body, meaning without it, even good vitamin D levels cannot function properly. The scientific references for everything I'm sharing today are linked in the description below. Number 6 is something I call deliberate hunger windows. And most people over 60 have been taught the exact opposite. You've probably been told to eat small meals all day long to keep your metabolism stable. But emerging research on a practice called time-restricted eating is rewriting that advice, particularly for aging bodies. A clinical study published in the journal Nature Aging found that adults who restricted their eating to an 8 to 10-hour daily window showed a 38% reduction in a biomarker called IGF-1, which is insulin-like growth factor, essentially a hormone that when chronically elevated tells cells to keep dividing. Cancer is at its core uncontrolled cell division. By giving your digestive system a true rest for 14 to 16 hours each day, you allow your body to enter a state called autophagy. Think of it like your body's internal cleanup crew arriving to sweep out damaged and precancerous cells before they become a problem. After age 65, the body's natural autophagy rate declines by roughly 40%, which is why this practice becomes especially critical the older you get. A practical approach is to finish your last meal by 7 in the evening and not eat again until 9 or 10 the following morning. Take your meals with healthy fats like avocado or olive oil, which enhance the fat-soluble nutrient absorption during that eating window. I had a patient, Margaret, 74, from Nashville, Tennessee, who started this approach after a precancerous polyp scare. Within 18 months, her follow-up colonoscopy came back completely clean. Her gastroenterologist was stunned. Number 5 is one that sounds almost too simple. Controlled cold exposure. Before you roll your eyes, hear me out. Researchers at the Karolinska Institute in Sweden found that regular brief cold exposure, meaning cold showers or cool water immersion lasting just 2 to 4 minutes, triggers a dramatic surge in a protein called cold shock protein RBM3. This protein has been shown in peer-reviewed studies to stimulate natural killer cell activity. These are your body's frontline immune soldiers that identify and destroy cells showing early signs of cancerous mutation by up to 44%. After age 75, your natural killer cell count and efficiency decline by as much as 35%, leaving the immune system less equipped to catch these early cellular errors before they escalate. The protocol that appears most effective is ending your morning shower with 2 full minutes of the coldest water your tap can produce. Do this 3 to 5 days a week. Pair it with a warm cup of green tea afterward. The epiglycan gallate in green tea, a powerful antioxidant, works synergistically with the activated immune cells to enhance cellular surveillance even further. Now, before we continue, I want to take a quick moment. If you're finding this information valuable, and I genuinely hope you are, please give this video a thumbs up right now and subscribe if you haven't already. It costs you nothing, and it tells me to keep going deeper on topics like this. Your support makes this channel possible. And now, speaking of support, where in the world are you watching from right now? Comment your city and country below. We have viewers from all over the globe, from London to Lagos, from Manila to Melbourne. And I absolutely love seeing where this community reaches. Tell me your city and country right now. Number 4 is weight-bearing movement done in short, intense bursts, not long cardio sessions. In fact, those can sometimes elevate cortisol, a stress hormone that suppresses immune function. What the research points to instead is something called resistance interval training, brief, intense bouts of muscle-challenging movement lasting just 12 to 20 minutes. A study from the American Cancer Society found that adults who engaged in at least 150 minutes per week of moderate to vigorous muscle-loading activity had a 23% lower risk of 13 different cancers. But here's the part specific to aging bodies. After age 60, we experience something called anabolic resistance, where the muscles become far less responsive to normal protein and exercise signals. Short, intense bursts of movement actually bypass this resistance by triggering a different biochemical pathway involving something called mTOR complex activation. Think of it as a special key that unlocks muscle growth even in an aging body. And why does muscle matter for cancer prevention? Because skeletal muscle is one of the body's largest metabolic organs. More muscle means better blood sugar regulation, lower circulating insulin, and a significantly less hospitable environment for cancer cells to thrive. Simple exercises, bodyweight squats, wall push-ups, stair climbing done in 12-minute sessions 4 times a week are enough to begin seeing protective benefit. Number 3 is one that sounds almost irresponsible until you understand the science. Controlled emotional stress release. Not the elimination of stressing, but intentional structured release of it. Chronic low-grade emotional suppression, the kind where you bottle things up, stay stoic, never express fear or grief or anger, has been directly linked to elevated cortisol levels and reduced activity in something called natural killer cell lymphocytes. A landmark study from Ohio State University found that individuals who engaged in regular emotional expression through journaling, group therapy, or even structured conversation showed a 19% improvement in immune surveillance markers over 6 months. Think of suppressed emotion like a slow leak in your immune system's engine. It doesn't fail all at once, but it gradually drains the resources needed to fight cellular threats. For seniors specifically, social isolation and unprocessed grief are epidemic-level problems that the medical system rarely addresses in the context of cancer risk. The practical application here is 15 to 20 minutes of expressive journaling each morning. Writing without editing, without judgment, whatever is on your mind, or joining a group, and whether in person or virtual where honest conversation is the norm. Pair this with magnesium glycinate taken at night, as magnesium directly lowers nighttime cortisol and improves the restorative sleep during which your immune system does its most important repair work. Number 2, the one I teased at the beginning of this video and the one that floored me when I first read the data. The second most powerful cancer protective habit of the longest living seniors is this. They regularly consume fermented foods, and they do so in ways that most Western diets have almost entirely abandoned. I'm talking about real traditionally fermented foods. Kimchi, kefir, naturally fermented sauerkraut, miso, and live culture yogurt. A groundbreaking study from Stanford University published in the journal Cell found that individuals who consumed 6 or more servings of fermented foods per day showed a remarkable 45% increase in microbiome diversity and a measurable reduction in 19 inflammatory proteins, several of which are directly implicated in cancer cell proliferation. Inflammation is the soil in which cancer grows. Your gut microbiome, the trillions of bacteria living in your digestive system, regulates up to 70% of your immune activity. After age 65, microbiome diversity naturally plummets, leaving the immune system increasingly reactive and increasingly blind to early cellular threats. 2 servings of traditionally fermented food per day, a small bowl of kimchi with lunch, a cup of kheer in the morning, begin to meaningfully shift this balance within just 8 weeks. Pair fermented foods with prebiotic fiber from sources like slightly green bananas, raw onion, or cooked and cooled potatoes. This fiber feeds the beneficial bacteria and amplifies the immune-up supporting effect dramatically. My patient Robert, 81 years old from Edinburgh, Scotland, added kefir and miso soup to his daily routine after a prostate scare. 2 years later, his PSA levels had stabilized, and his oncologist noted a marked improvement in several inflammatory markers that had previously concerned her deeply. And now, number 1, the single most powerful, most consistently documented, and most chronically overlooked habit among seniors who appear to age without cancer. It is sleep. Not just any sleep, but deep, structured 9 to N and 1 or 2 hours of restorative nightly sleep with consistent bedtimes. Before you say that sounds excessive, let me share what the science is telling us. Research from the University of Chicago and the National Cancer Institute found that adults who regularly slept fewer than 6 hours per night had a 36% higher risk of colorectal cancer, a 40% higher risk of breast cancer, and elevated levels of a marker called C-reactive protein, a sign of systemic inflammation that is now considered a significant independent cancer risk factor. During deep sleep, your body produces the highest levels of melatonin, not just a sleep hormone, but one of the most potent endogenous antioxidants known to science. Melatonin inhibits angiogenesis. That means it blocks the formation of new blood vessels that tumors need to grow and spread. After age 70, melatonin production drops by as much as 80% compared to youth. This is not just a sleep problem. It is a cancer vulnerability. Creating a sleep sanctuary, blackout curtains, no screens after 800 p.m., a consistent 10 p.m. Bedtime, combined with 0.5 milligram of melatonin taken 90 minutes before bed, can begin to restore this critical protection within weeks. Pair this with tart cherry juice, which contains natural melatonin precursors and has been shown in studies at Louisiana State University to increase sleep duration by up to 84 minutes in older adults. Here is what I want you to take away from everything we've covered today. It is never too late. Whether you are 62 or 82, your body retains an extraordinary capacity to respond, to heal, to protect itself when you give it the right signals. The people in your life who have grown old without cancer are not just lucky. They are often unknowingly doing some version of what we've talked about today. Independence, quality of life, the ability to be present for your grandchildren, to travel, to laugh without pain. These things are not guaranteed by genetics alone. They are built day by day, choice by choice, habit by habit. And you have more power over this than anyone may have ever told you. Thank you from the bottom of my heart for spending this time with me today. It means everything to know that you are taking your health seriously and that this channel is a part of that journey. If you are not yet subscribed, please do that right now. We have so much more coming that I do not want you to miss. And I have one final question for you. Do you personally struggle with any of the habits we covered today? Or do you have a parent, a sibling, a spouse, a friend who is facing a cancer diagnosis or trying to prevent one? If so, write their name or how they're related to you in the comments below. Let's fill this comment section with love and intention. And please share this video with someone in your life who needs to hear it. You might be giving them something more valuable than you